Так, у нас первый докладчик удаленно, поэтому ждем подключения. Да?
So we are waiting for our first speaker. Are you connecting him?
Не выходит? Ну что, тогда... Но будем надеяться, не будем прерывать докладчика, его будем подключать только когда докладчик закончит. Ну что, разрешите начать секцию?
So I would like to open our session, Prevention of HIV. And the first speaker is Ludmila Polyakova, Executive Director of the Public Union Equal to Equal Kazakhstan, the experience of the program to which works with young people based on Teenergizer model of that.
Начали по программе, вот там у нас госпожа Полякова устанавливает свою презентацию, так я понимаю. А Роберт Монгомери пока не вышел на связь, и неизвестно, выйдет ли.
So we don't know whether Robin Montgomery is going to connect. When he connects, so we will start his presentation. I'm just waiting for all of your presentations, dear speakers.
Ну, немножко времени у нас теперь образовался запас, можно немножко потратить на технические. Ну что там не получается, может быть, следующему докладчику дадим слово. Как у вас там? Техническая группа. Так. Вы можете следующего докладчика, Попович, поставить? Тогда мы попросим вас, Светлана, национальный координатор по антиретровирусной терапии Молдова.
So we will have the speaker, Mrs. Svetlana Popovich from ARVT, coordinator from Moldova. And so we'll speak about pre-contact prophylaxis in Moldova, and that's a matter which does not require any proof. And are you going to change my slides? For the first time, so we started to speak about that as an efficient, one of the efficient prevention methods a long time ago, and they proved its efficacy. And in Moldova, we tried to introduce this type of prophylaxis. So pre-exposure prophylaxis. And I would like to speak about HIV and the Moldova situation. So in the region, so this is a concentrated process which is current for men having sex with men, sexual workers, and users, consumers of injection drugs. According to the last behavior study, there is a decrease in the spread of HIV among users of injection drugs and sexual workers. And we have an important growth in the group men having sex with men starting since 2009.
Первые биоповеденческие
When we started to conduct the first Bayer trial, so we see the growth by 20 times. And if in the group men practicing sex with men here, the growth was around 1% last year, so it was 11.5%. And you see such a dramatic growth over the past 10 years. Talking about 390, so the estimated numbers for HIVs cannot be compared to the numbers in your countries. Around 15,000 of people who know their status. It's 66%, about 10,000 people. So the those who take ART, antiretrovirus therapy, 6,810, and with the viral suppression, 5,980. The prevention of HIV among the risks groups started to be introduced in Moldova in 1998. It used to be only the condoms and syringes distribution among the users of injection drugs, and we started to introduce those programs for men practicing having sex with men, and the prevention of the financing of this program amounted about 40%. It has the biggest share in budgeting of all of the events from the national program. And what else we could be proud of? In since 2018, there is a mechanism to finance the services and prevention from the state budget, and the national insurance company. And in 2018, 1.85 lays were allocated in 2018, 1 million in 2020, also around 1 million lei. And in other currencies, it's about 50,000 euros or $60,000. And I also said that there is certain decrease in HIV infection among the users of injection drugs among the sex workers, and the prophylaxis prevention programs are in place. And among about 60% from the estimated numbers, they receive the standard prevention service package, which includes not only the sterile needles and condoms, it includes info materials, includes the obligatory HIV test. And among the commercial sex workers, the percentage is lower, and the lowest percent, this is the most difficult group, so men practicing sex with men. Talking about pre-exposure prophylaxis, and we started to mention that in Moldova in 2016, when we had a study, and that happened when we had the quick tests, which were done by the trained employees of non-governmental institutions, and we also noticed the trend that the beneficiaries of our services, mainly men, practicing men with men in these groups, when they receive condoms and when they have the information about HIV potential infection, and after a while they do the test once in 6 months, and they first were negative and then positive when we developed our main norm. So this is the national HIV/AIDS program, pre-exposure prophylaxis. So we included that for the years 2016 and 2020, and the state and the public sector, we decided that there is no need for that when we noticed that trend, that people know how to do prophylaxis and they don't use it. And then we started to utilize the pre-exposure prophylaxis as one of the methods. We're not ready to review and change the program only for that purpose. And we were reviewing the protocols for HIV, the first known for pre-exposure prophylaxis. That was adoption of the National Clinical Protocol number 313, pre-exposure HIV prophylaxis. And the national protocols are obligatory for all of the medical institutions, and for the first time as the separate area, pre-exposure prophylaxis appeared for 2021, for 2021 till 2025. It includes the following measures. I'll give more details later on. Pre-exposure prophylaxis in medical institutions and in non-public organizations, NGOs. The update of the norms and regulations, national clinical protocols and standards, institutional standards, instructions of use, and also it includes the awareness campaigns about the pre-exposure prophylaxis, and also the roundtables to discuss the results. As I've already mentioned, the national protocol was adopted in 2018 by the order and decree of the healthcare ministry, and so the indication was HIV negative. No hints about the acute HIV and significant risk of HIV infection, and contraindication was positive status or signs of acute infection. In our national protocols, we do not focus on a certain specific group. We are not saying that pre-exposure prophylaxis is only for men having sex with men, and pre-exposure prophylaxis is applicable for all of those who have high risk of infections, irrespective of which group you attribute yourself to. And the main contradiction was exclusion of HIV infection on the day of the prevention measures to start, and the main scheme which is recommended by the national protocol. So it was the constant use of pre-exposure prophylaxis 7 days before risky situation, daily use of medication, and pre-exposure prophylaxis ends 28 days after the last risky situation. And this protocol is being reviewed, and we just do not use ongoing prophylaxis, and also it can be done at request. What are the main consultations which are recommended for those people who are taking pre-exposure prophylaxis? This is HIV test in line with the clinical protocols. The HIV tests are recommended every 3 months, and here we face the problem that after the first HIV test and before the start of the pre-exposure prophylaxis, they were negative in the first 3 months. We had 2 cases, then they became positive, and we changed the recommendation on the frequency of tests. And the first HIV test we recommend 1 month after the start of pre-exposure prophylaxis to exclude those people who were in acute phase. Syphilis test every 3 months. Hepatitis, viral hepatitis once in 6 months, once a year, and clear risk creatinine once in 6 months. and consultation on adherence and compliance, prevention of sexually transmitted infections, recommendation about contraception, pre-exposure prophylaxis recommended for both males and females, and it seemed to us that everything was fine. We have the protocol in place, we could start working, but to be honest, it was adopted in February 2018, and as of 2018, we had only one person who was doing pre-exposure prophylaxis, and that was a lady from a discordant couple where her spouse did not achieve, her partner did not achieve the viral load to be detected. And we realized that there were some barriers to be removed and changed. After the roundtable, we came up to the decision that not all of the risk groups are ready to come to the medical institutions. So pre-exposure prophylaxis was only for specialized medical institution for which could give out ARVTs. We thought that that was two types of activities interrelated, and for more accessibility of this type of prevention, we changed the way it was submitted. We introduced two other ways. In NGOs, non-commercial, non-governmental organizations, it was provide all of the consultations on compliance, all of the required tests. They are done with quick tests, and they are done by the specially trained employees of non-commercial organizations, and with the test results, they come to a medical worker who comes to visit that non-commercial organization to provide consultation, and if necessary, he also may assess the risk factors, and if necessary, he can prescribe pre-exposure prophylaxis. So this is a community pre-exposure prophylaxis. Some NGOs introduced the mixed type pre-exposure prophylaxis, talking about the advantages of pre-exposure prophylaxis. If the patient is ready for pre-exposure prophylaxis, they accompany him, and they follow him up to the medical institution for the pre-exposure prophylaxis to be prescribed. The next slide. And I spoke about three models of pre-exposure prophylaxis. There are three models that we have in specialized medical institutions where people come to, and they get all of the services, and they are procured centrally. These pre-exposure prophylaxis medicines. In specialized medical institutions, the services are paid from the budget of the national insurance company, and in NGOs, so the external funds are used, and from the Global Fund, from UNAIDS, and in 2021 only the Global Fund, they are paying the salaries for employees of NGOs who are dealing with the non-pre-exposure prophylaxis, and if necessary, some of the studies, if the tests which are required for creatinine clearance, they are also paid from the Global Fund. And at the specialized medical institution, the consultation is provided by the compliance specialist, and tests for creatinine, HIV, syphilis. It is done in the procedure room of that center, and the medical tests are performed in the lab of this medical institution. if we are talking about non-commercial organizations, about community prevention, so the consultation on the advantages, on compliance, on advantages, all of the quick tests are provided by the NGO employees, and the medical temporary employee is providing all of his medical evaluation. And the mixed type, on the consultation on the advantages of pre-exposure prophylaxis by NGO, and then the customer client who thinks that probably he needs this prophylaxis, then he's accompanied by NGO employee to a specialized medical center. Talking about the results, as I mentioned, as of end 2018, only one person was receiving pre-exposure prophylaxis, and as of end 2019 there were 90 people, and as of end 2020 192 people. Most of them were receiving that prophylaxis in NGOs, 131 person, so they preferred the community NGOs, and in specialized medical services there was 17 people. So this is the partner from a discordant pair, where he did not want to use other prophylaxis, and pre-exposure prophylaxis does not exclude other prophylaxis, and we say that when we provide consultation, and 192 people on the prophylaxis, pre-exposure prophylaxis, most of them belong to the risk group, men having sex with men, practicing sex with men, and males practicing sex with males, so they do that at a request short course of pre-exposure prophylaxis, and almost 60% of such men, they prefer pre-exposure prophylaxis in short courses. And how we introduced the pre-exposure prophylaxis, but if we speak about the impact of COVID pandemic, and so the services we provide, so they changed when the emergency situation was announced in the country, in line with the healthcare ministry order. There was a decree which said that employees of NGOs can, at the consent of the patient, those beneficiary of pre-exposure prophylaxis, they can deliver the medication because it's centralized, and also web outreach was used, consultation by medical staff and employees of NGOs for our clients and beneficiaries of our services online, and also the search of prophylaxis, so we used VOT. Thank you very much. If you have any questions, so I'm happy to take them. I did not just interrupt the speaker. We have only 15 minutes for the presentation, and she spoke for 20 minutes. Then I have a suggestion. Everybody will have 15 minutes, and we have 4 speakers left, and then we will have the Q&A session, because there is a risk that we won't be on time. Okay, so your question will be left, and I would like to give you the floor. Thank you very much. Thank you for your presentation. That was very interesting. And so we saw how you can work with the failures, and this is like real work. This is very important.
Well, good afternoon, everyone. My name is Ludmila Polyakova. For me, it's a big honor to take part in this conference, given it's such an important conference. I would like to say thank you to the organizers for inviting me here. And indeed, I would like to say thank you to you, to all who came here. We are not here by chance. We are the people who contribute in fighting epidemic of HIV, COVID pandemic. So thank you for your important work. So I will get started. My presentation is about experience to introducing program with working with young people based on Teenergizer program. What is Teenergizer is about? It's a movement that brought together teenagers from East Europe and Central Asia. Together we create a world where each teenager can fulfill his own potential. A world where rights of young people shouldn't be protected because they are being followed. This movement included Russia, Ukraine. Actually, Teenergizer was established in Ukraine, Tajikistan, Kazakhstan, and Kyrgyzstan. I think I missed one slide. No, I haven't. Talking about Teenergizer products, Teenergizer has a number of ingredients that are fulfilled in this the work of this group. So I just will mention it now. So I'm talking about such components as which party online consultations, trainings, protection, and research. A few words about our history. How did we get started? In March 2019, there was held a Spring School of Leadership for the teenagers that live with HIV. It brought together 8 teenagers from Kazakhstan, and the trainers, coaches were from trainers from Teenergizer. So when they met together, when they saw the energies, they said, we want to have a similar organization, and we started to introduce this movement in Kazakhstan starting from 2019. So we thought what we could do in order to improve lives of our teenagers. We communicated with each other. We were looking for a facility. We applied for a grant. And therefore, in the summer of 2019, we finally opened our group. In 2019, first of all, we decided to mobilize teenagers as a whole, and we started to work with teenagers living with HIV and those who live in Almaty. We talked to their parents. We held a number of trainings within our community and also at a youth center. Additionally, there was a winter school of leadership that was organized together with Teenergizer. So we held a number of events that helped for teenagers to communicate to each other, to strengthen their community, improve their knowledge about HIV, so that in future HIV would not influence badly their life, so that they had confidence in their future. Afterwards, we held a number of trainings. What is it about? It's a Teenergizer product that allows to train new members of the community. We tell teenagers about HIV. We talk about such things like gender or sex, and we have a manual that we use at our classes. And when we started to perform such trainings, we applied not only to teenagers that live in HIV, but we also involved their friends, their relatives, and other teenagers who have a very active approach in life. We have held so far 2 such trainings. At the first one, we had 12 graduates and 10 at the second one. So these guys have completed the training, and many of them afterwards might become trainers in future if they wanted to. As for the party, this event is about organizing an event. It should be a public event that will cover such topics as HIV, and afterwards we do testing. After the event, we do testing. We organized this event in a students' outpatient clinic. It was held at a moment when COVID started to spread in Kazakhstan, so we could not bring together a large number of students. But at the same time, we did it. We did it in the students' outpatient clinic, as I said. And so we provide testing for everyone who came there that day. By the 1st of December, we organized a special campaign. Our members have prepared a quiz, so they would approach young people at the central street, in the central street of Almaty, asked questions, and for each right answer, respondent would get chupa-chups, and for a wrong answer, he would get a condom. And then those young people were invited to our center. Our center also holds testing. As for component of protection of rights, well, in Kazakhstan, in 2019, there was an outbreak of violence. Therefore, local teenagers decided to hold an action against violation that influence teenagers or those who have gender differences. So they did a performance in the central park of Almaty. They showed that performance in various places of the city. They had white clothes. They drawn masks on their faces. As you see, young people could be very creative if they feel touched by a certain topic. In 2020, before the health code was adopted by the Ministry of Education, there had been adopted a decree so that allowed young people to get health service without children's approval, without their parents' approval, sorry. So we believe it's a very important step because it really helps to improve the situation in the country. So we held a meeting at a very high level at the Ministry of Education, and one member of the group is a young blogger. He raises very interesting and important topics in his blog, and then he makes a video on his YouTube channel. Then we hold trainings before the pandemic, we would hold trainings in our center. After the lockdown was launched, we started to hold trainings online. So I will show you a slide where we organized a course. We organized a summer online camp. While we were organizing the online camp, we understood that not everybody has online access because not everyone has a cell phone. So they might have a computer, but only one in the family. So together with the Janssen's support, we provided about 300 tablets to teenagers in various parts of Kazakhstan. And we held a summer camp where 88 teenagers took part. It included support groups, some videos on Instagram, and so on. And our teenagers, together with Teenergizers from Ukraine, underwent a training and got certificates on various topics. As for online consultations, on this slide you can see our team that provide consultations. As for the gender, we have more men, guys, than females, but nevertheless they do a very good job. They provide consultations online. We also have a psychologist. You see her photo in the left upper corner. And that's it. Thank you very much for your attention. At the end, I would like to encourage all of you to join our Teenergizer movement. Let's create a world where each teenager can fulfill their potential. Well, thank you very much for your report. So indeed, you have been very creative. You use often new approaches in order to prevent prophylaxis. And I would like to switch to the next topic. Our next speaker is Atamanchuk Alexandr from the Republican Center of Hygiene and National Health. Good afternoon, dear colleagues. I would like to welcome all of you. For those who watch the conference online, I would be talking about prophylaxis of HIV infection in key age groups of the Republic of Belarus. As for classification of WHO epidemic situation in Belarus is assessed in the following way. On the 21st of January of 2021, the incidence of HIV in Russia was at 0.24%. So there are 28,000 people living with HIV for Belarus. The significance is for the three age groups: people who use injection drugs, men having sex with men, and sex workers. Overall, we can say that prophylaxis strategy is realized in Belarus starting from 1996. Non-commercial organizations started to operate 2017. Prophylactic measures for those who use injection drugs the services can be provided in anonymous centers and mobile labs and centers of national health. As for the highest incidence of HIV is among the people using injection drugs. Prevalence in this group is 22.7%. By social questionnaire, the overall number of HIV infected people is 80,000 people in the country. 54% of new cases of HIV infection and 46 deaths by HIV. Today in Belarus, among the people use injection drugs together with opiates, we see a higher use of synthetic drugs that stimulate sexual activity, modifies control of behavior, and leads to paranoid mood. By the results conducted together with UNESCO, 67% of people using injection drugs use stimulants, psychiatric stimulants, and opiates. 70% out of them have tried in groups. 67% out of them have used syringe and filters to prepare such drugs. 43% of people using injection drugs do not use condoms during sexual contacts. Prophylaxis measures for people using injection drugs are provided in 27 cities. Overall, prophylaxis services are provided in 32 anonymous centers to prevent HIV. 19 of them work at the basis of national medical facilities, and others operate at non-commercial organizations. The basic package services for people using injection drugs include exchange of syringe and needles, consulting, and provision with condoms. Also, we provide testing on HIV, test for parenteral hepatitis, medical consultations for infections transmitted sexually, screening on tuberculosis, and assistance for such patients in order to use to provide services for the men using injection drugs. In 2017, 10 medical facilities have established working groups to prevent HIV. In 2018, 18 organizations, including the 10 that started operating in 2017, opened prophylaxis rooms. In 2019, we opened one more prophylaxis rooms. Therefore, in 2020, we had 19 prophylaxis rooms in Belarus, aimed to provide services for people using injection drugs. The first room for opioid replacement therapy was opened in 2007. In 2014, the number of such rooms increased to 18. Today, the services of replacement therapy are provided in 20 medical offices in 18 cities. By the end of 2020, the replacement therapy was provided to 96 patients. 46% of them are people living with HIV. In other words, 91% were covered with antivirus therapy. As for the sex workers, prevalence of HIV accounts for 10%. So 3.5 new cases account for this group. The number of sex workers in Belarus is 18,600 people. Due to a high level of stigma and criminalization, this group has a very low access to medical services. Among sex workers, there is a high risk of HIV infection due to the lack of using condoms. Most of them do not use condom due to the request from the customers. And 40% of them do not use condom with their partners. 26% of sex workers have used drugs. Overall, prophylaxis services for this group, for those who use injection drugs as well, are provided in 6 non-commercial organizations and 11 anonymous medical rooms. Basic services package includes consultations, programs to provide condoms, exchange of syringe and needles. The additional services are consultation, HIV testing, consultations on infections transmitted sexually, assistance for patients having HIV, and psychological support. As for prevalence of HIV in men, having sex with men is accounted to 6%, which is 32,000 people in the country. 20% of new cases of infecting which is accounted for this group. Overall, it should be noticed that due to a high stigma, the significant amount of men having sex with men do not use any prophylaxis services. About 42% of them do not use condoms. 20% of them do not use constant sex partners. As for men having sex with men, in the Republic of Belarus, it is typical to change partners frequently. 29% of men having sex with men practice group sex. 75% have had sex under psychiatric drugs. 75% of men having sex with men have also had have sex with women, which means that it's a significant group comparing to other population groups. Prophylaxis services providing services for this kind of group is provided by one organization that includes 4 centers of men's health, 2 and 7 anonymous consultation services. The basic service package includes consulting, distributing condoms, and so on. As for additional services, is HIV testing, medical testing, consultation on infections transmitted sexually, testing for TB, and social support for those who have HIV infection. In 2020, the coverage of basic services among men and among people using injection drugs was 60% and 41% for men having sex with men. The amount of tests for HIV amounted for 64% among men having sex with men, and 28% among sex workers. As for results of the surveillance agency, it proved the high efficacy of prophylaxis measures in key groups of population. So prevalence of HIV in people having injection drugs, it decreased by 2%. As for sex workers, this figure is still increasing, unfortunately. Well, thank you very much. Well, thank you.
Очень полноценный такой доклад. Это все.
So it is all done in the state institutions. So the replacement therapy, yes, by the healthcare institutions which are public for consumers of injection drugs. So these are governmental, non-governmental institutions, and also for men practicing sex with men. These are non-governmental institutions, and we are introducing the social projects when it is done by NGOs, but using the public budgetary funds. And I told everyone just not to ask questions, but I asked the question myself. Okay. So the next speaker, the next presentation, prevention of HIV and hepatitis B and C among people consuming drugs during the pandemic of COVID-19. I'd like to give floor to Mr. Alexey Lakhov, Director for Development of the Foundation of Human Interaction, Russia. Good afternoon, dear colleagues. I should use this disclaimer. This presentation done by the international agent, but we have the legal procedures in 15 minutes. Maybe in 15 minutes I would use another status. For we are listening to all the foreign agents and foreigners without any problem. Thank you. Our organization is called St. Petersburg Charitable Foundation Human Interaction, and we work in St. Petersburg since 1995, but we are officially registered since 2001, and this is the oldest and the biggest program in Russia, and we cover 50,000 people usually. These are users of drugs, sex workers, men practicing sex with men, in chemical sex, and people who live with HIV, hepatitis, or tuberculosis. We have 3 mobile stations, decrease of damage, and then we are launching 1 more. And we have a stationary station for the low-level medical care, and we also have the homeless people, children from migrants from another NGOs. They are referred to us, and other vulnerable groups of populations. And one of the important enablers for that, we have several licenses for medical activity, for pharmaceutical activity, and for nursing care as well. That's why we can do blood tests and provide different medical services. I'm not going to go into details of all of the norms and regulations on prevention of COVID in St. Petersburg, and I will just speak about the services which were still providing that during COVID pandemic. Why it's important? People who use drugs in line with the UNAIDS and in line with the European Monitoring Center for Drug Addiction and Prevention of drug usage were one of the keys in terms of impact from COVID, and in terms of forecasted, not outbreaks, but local concentrated number of cases of HIV when people are in the same place. And from COVID there is considerable psychological burden, and there is an increase in risky behaviors, and it can just trigger some types of risky behavior, the use of injection tools, and unprotected sexual contacts, and so on. And not to stop this work, we just changed quickly when there were the limitations introduced because of COVID, and our mobile station had to stop its work. So we shifted to another ways of provision of these services, and I will give you more details of them now. I wanted to just tell you an anecdote, but we arranged for delivery of our standard sets. They are sold at our mobile stations, and for a while they were also given away at our stationary point. And we stopped this work at our stations. We arranged for courier delivery. There were syringes of different volumes because we could not know the end user, so what kind of syringe he may need. We used also water for injections, and there was also a set for coronavirus prophylaxis. So, and of course naloxone. So for overdosage, that was clear when the pandemic just started. We forecasted that as of end of 2020 we'll have more overdosages in St. Pete because of psychological burden for the drug users and limitations of access to different services, and that would happen if as end of 2019 we had about 3,900 overdosages, not fatal, I mean the total number of acute poisonings as of end 2020 unfortunately was over 4,700 overdosages registered. In courier delivery to 347 people we delivered these package sets. Of course, the courier service did not know they were supplying these type of sets, so it was all happening under the help to most vulnerable groups of population, and we had a mobile outreach. Our own employees, they volunteered to go to the locations where our mobile stations used to be into groups of 2. At request of the participants, we would give away those sets for prevention of COVID and decrease of damage in 2 months. Over 1,000 sets were given out, and there was top demand from our users. And an average of 15 people would come to one station, and they were very thankful, and they were surprised that during COVID times, and especially if these were people with hepatitis and HIV. Everybody forgot about hepatitis, and if we continue to work with HIV and the hepatitis people, they were just lost, and they were thankful for that, and they could not understand how people are driving their own cars, and they give them these sets, and they also include the COVID prevention sets, and we received a lot of positive feedback. And we arranged ARVT supplies with the help of the institutions of St. Petersburg and Leningrad region, with the help of case managers. So that was the following scheme. People would give us the power attorney, and it can be just given by the mobile phone. It could be a photo, and our people would deliver those medicines to the home address of our beneficiaries, and you see that over 88% of those people who received the services, those were active drug users, and we just try to help to keep the compliance in this vulnerable group at the top level, and many people who did not use our services and learn about the potential possible adversary to use that. If in the first wave of coronavirus infectious wave, so 45% were primary clients, and in the first wave it was 92%. That's good because people, after they learned about this service, they actively used it, and we delivered ARVT to the institutions which were closed. So these are narcotic tuberculosis hospitals, and with how they were just helping the patients of those institutions not to just stop ART, and we arranged for self-test of HIV. That's hard to do because there are no saliva tests, and we hope that it will be solved, and at that point of time that service was possible and arranged for distance tests. They were delivered by the couriers, and that was done either by video and through the messengers, Telegram, or social media. And also pre and post test consultation. We had a psychologist working. This is how in just in a month and a half we did 62 tests, and 7 were positive, 4 were primary results. And that is an interesting moment when one lady ordered self-tests for her children. She and her husband, they are drug users. Both are HIV positive and remission. She ordered that for her children who are minors, and one of them already started sexual life, and she ordered such tests to make some prevention for her children. And then she also left a positive feedback. And I would like to mention Elton John AIDS Foundation, who helped us, and also Johnson & Johnson, who had the COVID grant, and Citation from France, and we need help, and also private contributors, and the Fund for Presidential Grants also arranged for special COVID project. That may seem strange, but because of COVID infection, we had lots of advantages. In the first place, we managed to really change our work, and it became possible thanks to web outreach, and our colleagues mentioned about that, and we are also piloting that with the support of the Department for Drugs and Crimes, and we have new clients, and we thought we'd have less users, and during this coronavirus limitations, the number was decreased by more than 40%. We covered about 60%, and there were lots of first-time customers who stay with us, and who still stay with us because of the coronavirus infection. And the organizers, I would like to thank them for giving me this invitation to participate here, and how that in 15 minutes so hours it will remove. So stop doing that. Thank you, Alexander, for just wonderful presentation. Alexey, sorry. Yes. In the end, we have one more speaker connected. The next presentation will be done by Alexey Mikhailov. Expansion of ART of ARV therapy as a practice of anti-pandemic activities. Alexey Mikhailov, Health of Coalition for Readiness to be Treated. So we will have the report in a couple of weeks, the final report. Now we are going to have in 2 weeks the final numbers. These are the antiretroviral medicines, and this is the disclaimer that you may see here. And so I would like to say that our data may be adjusted in the final version. So here it's like a different topic because I'm going to speak about treatment. Treatment may also be prevention, and I will speak about preventative medicines and also about pre-exposure methods. This is like official general data from the Federal AIDS Center, and according to them there is room for improvement, and if we are investing lots of efforts to get to good indicators of RT coverage, and the viral load indicator is not so good. We have issues with diagnostics, and unfortunately because of COVID it was even worse because the labs were used for COVID. Not everybody could do the tests on time. Maybe that's why the indicators are not so ideal this year. So it's about the costs in the recent years. And last year, the 5-year HIV strategy was finished, and we will compare what was 5 years ago and what we have now, what are the achievements, what we have achieved, what we have not, talking from the point of view of financing. The budget grew considerably, which helped to increase coverage with the treatment by several folds. That was about the financing. And customers, so healthcare ministry that can be, and also the penitentiary institutions, and the penitentiary institutions, so the indicators are even better. When people come to AIDS center, they don't get the treatment that they used to be getting when they were in prison, and this is a problem in terms of interactions with the state authorities. This is the procurement for 2020. So the patient use FIV a lot. That's a known medication. Yes, it's quite efficient, but those side effects that it has, well, they just make many people stop their treatment. They get lost, or they start to buy themselves the medication. Dolutegravir share is growing in 2021, so we will have even more of that based on the trends that we currently see. About dolutegravir, so we can see how the amounts are growing and the price is going down. Talking about the mechanism to decrease the price, and I think this year there was another important attempt to decrease the price to the level of per-cell. So to have these long-term contracts, this is a 3-year contract for DTG, which decreased the price by 30%. Let's see what will happen next. We would like the price to be even smaller, much smaller. And it's not so positive, but in those 5 years we see the increase in FIV rents and lopinavir, ritonavir, according to my opinion, the opinion of my colleagues, it's because efavirenz, it's cheap, about 600 rubles. It's about less than $10, and based on the indicators that we had in strategy, wow, so the regions were using that. In the beginning today, I was talking to colleagues from Kazakhstan, and they were talking about combined forms. We are not good with them. And the anti-monopoly service they make are split into components. If separately, they cost less. I think that this trend is going to persist, but still we need to get to an understanding that patient compliance is more important. And so this is the drugs. So the growth was insignificant. This is a one pill treatment, and some patients cannot just take 2 or 3 pills, and even one. 1 in 2, this is better, 2 in 1. So limited to Vadim. Many countries that do not use that, but we are still using it. And also we have things to work with, and where we can find the evidence, and the Federal Center for AIDS could make some big story to just convince the Federal Antimonopoly Service and the Healthcare Ministry about the importance of the dosage and compliance. So another important thing, not all of the modern medicines are used in our country. Some of them are present, some not, and we will have the review of the list of the drugs which are important to life conditions, and some of them are in this list. And here we have also the danger of using several pills if they are not on the list of the drugs which are used for life-threatening conditions, and they are not procured. We could go in further. For post-exposure prophylaxis, it's not so good because the volumes are small, only for medical employees, and all of the representatives of the public sector that work with the patients. There are some emergency cases, and people are just lost, don't know where to take these drugs from. They may find that in big cities, in pharmacies, but that is a big problem. This is the way how we could decrease the number of new cases. And so this is the price for treatment scheme in 2020. And the data is not included, but if we compare what was the price 5 years ago, so it cost 100,000 rubles, and now the cost is 10,000, which is lamivudine, tenofovir, efavirenz. I think there is no room for improvement in the price here, and the federal and regional healthcare ministries should use efavirenz 400. It's less toxic, and So it's about the competition, long-term contracts that I mentioned earlier. We see that competition on the federal tender is absent, and in the recent conversation with the state institution, which is procurement, just suggested them to procure all of these medicines for long-term contracts, and so there is no competition and they can be direct agreements. The price would go down, and also the patients would feel safer. It's not a good number. On one hand, that we have some shortages of therapy. Then in 2020 we have less information from the patients. So on the website periboy.ru that they have some shortage compared to 2019. I mentioned that several times in the interview. And also our actions help to stay in compliance, and the school for patients which were online, even the person was at home, he would receive the required information where he has to go for what, and the only problems that we had, these were the tests. And this is the recommendation that I mentioned partially about the Federal Anti-Monopoly Service. I mentioned that, and there is one problem that I know which is being solved. These are supplies to the regions, and the country is big, and the official distributor is just selected where he's supplying from Vladivostok to Kaliningrad and vice versa, without just identifying the problematic regions. But unfortunately not now, and we will work more closely with the distributors about that, so that the regions with deficit are getting the drugs in the first place. Thank you for your attention. Thank you for such a detailed presentation. And now we have Ivanova Ekaterina, coordinator for HIV, AIDS, and labor in the Russian Federation from the International Labor Organization.
Добрый день.
Good afternoon, dear colleagues. Vadim, we are very pleased to greet you. We can hear you very well, even though we do not see you. Okay, I hopefully our technical experts will do their best in order to switch me in. Oh, I see you're in a great shape. So you've been working online? Certainly, International Organization on Labor shows a very responsible sets a very responsible example to all of us. Starting from September 2020, we have been working remotely, and sometimes once in 3 weeks we can work from the office. So starting from May, we probably will be working from the office. I'm pretty sure that won't influence the quality of your presentation. I just wanted to say that it is very important to follow the guidelines that we try to promote. Yes, appropriate working conditions. So we have not been spending time in lame, and even you, Vadim, as I remember, took part in one of our initiatives, and I've been talking about new ways to prevent HIV during the times of COVID pandemic. The video you've just seen, we showed on our TV channel that we also distribute among professional organizations throughout Russia. Well, what did we face last year? Prevalence of COVID-19 changed the focus of the public attention to itself, and other very serious infections were not covered with the intention. We faced limitations in movement and chances to work with our audience, including voluntary testing among workers. As the AIDS centers, they had to help fighting COVID-19, and even though we started to work online, it was impossible to continue our work as most of medical specialists worked to fight COVID. Even at the same time, our problem didn't disappear. We understand that at all times we face lack of specialists that can work, and there is awareness of HIV infection in Russia. Starting from 2019, we thought how we can automate the information provision. We talk about the delicate character of the problem, and we must talk about prevention. Do everything you can in order to avoid infection. Also, the second thing is to promote regular testing. If you get infected, you should find it out as soon as possible. Tolerant attitude to people living with HIV is the third thing, and orientation at good treatment in terms of positive result. So we should not neglect any of these aspects while organizing our work. And that's what International Organization of Trade is focusing about. What else do we focus on? We see a sustainable increase of engagement among the population of Russia. As we see, 64% of infected people are heterosexual adults, and the share of people that were detected that had a positive HIV test is accounted to 80%. Still, we have a lack of information materials designed for this age group, 30 to 50 years old, from socially favorable area. And we do not understand the mechanism of infection, lack of post-contact prophylaxis among working groups, and so on and so forth. So all this special information is well known to specialists, but still we don't know what to do. So what conclusions did we do? At the end of 2019, we established, together with professional advertising agency and information stands that included basic information on prevention, information on sustainable testing, tolerance attitudes of people living with HIV infection, and motivation to treatment. Why did we focus on information stand? because we want that at each company, at each production site, there was information on what to do if you risk HIV infection. It's a standard way to inform workers about initiatives that company has adopted. Additionally, we printed out two kinds of leaflets. One was to motivate to take part in promotional campaigns in order to increase the number of testings, and second was to organize such testing campaigns. This information can be found on the link that I have provided on this slide. I hope that all these presentations will be found on this link. So these leaflets can be uploaded. You can use them. You are very welcome. So if you like it, we'll be very pleased to share it with you. Next thing, today we have issued a cycle of 4 teleprograms that are called HIV in the sphere of labor. It includes a number of very important materials, relevant materials. For example, the third program describes in detail what can be done in large companies, and as examples, we show what Russian railroad company have done in order to improve prophylaxis prevention of HIV there. What else have we done? At the moment, together with the Institute of Labor, we are developing a course in order to raise awareness of HIV and AIDS at workplace. We have done a number of coaching previously, and that's what we are going to do in future as well. Today, we do understand that online trainings are more efficient, and this is a great idea that these 8 trainings are going to be included as a course in order to improve qualifications for all leaders in this area. We are going to introduce it in December, and I would like today to all of you motivate your work representatives so that they use it and improve the situations throughout Russia. Interactive roundtables together with regional groups and its center together with federal regions. In May, we are going to hold such roundtables in south and eastern regions of Russia. So it's going to be in real time. What else did I want to talk about? When we prepare any information materials for our audience, it is very important to take into account stigma and fears that exist in the society. Therefore, when we developed our materials for the stents I've been talking about, we made a social research together with social experts in social science. So, for instance, in the city of Elektrostal, Orekhovo-Zuyeva, and IKEA store at Soplistan district, so we held a round table involving white collars and blue collars in order to understand what is understood, what is clear, and what is not about AIDS and HIV. And the results are very surprising, because we do understand that unfortunately people have lots of stereotypes and that we have to fight. What have we found from our target audience? Found out? most of the respondents do not understand the difference between HIV and AIDS. Do they have to understand it? Certainly they have to understand it. They should understand that AIDS is a terminal stage. It is a very important, it's a very important information that have to be delivered to people. There is an opinion that HIV can be infected among those who live unconventional way of life. So we try to deliver information that that some people have HIV, but most of people believe that socially, people from socially favorable levels of society just cannot get HIV because this is an infection of socially deprived group of people. We do understand that HIV and AIDS have a very negative information. We know that it's described as the worst disease of the century. What else have we been talking about? We tried to explain how HIV is transmitted among individuals and talking about 4 liquids such as blood, sperm, breast milk, and so on, give you an idea how you can get an infection. We, for example, heard at our seminars, and so they asked, what happens if menstrual blood gets onto my foot where I have a blister? Such simple questions are asked in a typical conversation. So that means we have to understand, we have to explain what will happen and what will not. What are the most important moments are still omitted. So sources of infection, that virus is killed fast in external environment, that there is external prophylaxis, that treatment is easy, it's accessible, and it's a lifelong treatment with a few pills daily. The target of virus is any person, regarding age, gender, and social status. And that's the questions we tried to answer. Here you see our 3 consultants. Svetlana is Zimbaeva, whose picture I saw at previous slides. Nurmilko Mikhanov, her husband, Polina Sitich from Ekaterinburg. Svetlana and Polina are our regular speakers at our seminars, and they shared their personal stories. They took part in the shooting of video. So what did we hear from the respondents? That first of all, that this information add trust to informational materials. When they see a real person, when they see the everyday schedule and so on, so it eliminates a negative approach. So we regard them as usual people, not as some drug addicts that we all are trying to avoid. So these are the real feedback that I heard at each interview in the 3 settings I've mentioned previously. The photos of successful people living with AIDS give us an impression that these people are even more active, more positive than me, which means that virus is not that bad, that I can go and make testing and I will get necessary treatment, and I will regard my colleagues. I won't change opinion about my colleagues should I find out about his infection. So we recommend in each region to introduce testing at each large production sites. In real life, the respondents said they have never done such testing voluntarily because they believe they're out of the risk group and there is no need to do it. Many respondents believe that such promotional campaigns will be very useful for them, given the information they have learned from our stands. They believe that it will be anonymous 100%. They will get a good consultation from an expert, and now they know about such promotional campaign and they are ready to take part in it. What else can be said? That such an idea as AIDS center is not perceived by an average individual. Many people just have no idea about such centers, that such centers exist. Some of them think it's a charity fund. We've been talking about hotline, a similar hotline that exists in oncology and so on. We still do not have a dedicated line. And here are a few examples of the materials we have issued. Unfortunately, we are running out of time. Okay, I'm done. Thank you very much. Well, thank you very much. Actually, we have 3 minutes to ask questions. Well, thank you very much for your great report. It was very informative indeed. Okay, does anybody have a question to the speakers? We still have 3 minutes. Well, good afternoon. I am from Armenia. I have a question to my colleague from Moldova. I have 2 questions, in fact. So, did you have a license to provide medical service? And the second question is, do you have any information on prevalence of infections transmitted sexually among those who received pre-exposure prophylaxis? Well, thank you very much for these questions. They are very important. If we talk about licensing for medical services, no, our non-commercial organizations do not have such licenses. Therefore, they use our medical personnel that work in specialized designated medical centers. They hired our medical employees in order to provide such service. So they would work there extra hours and provided the said service. Unfortunately, talking about prevalence of the disease among those who got infections transmitted sexually. So if we talk about syphilis testing, so out of 203 people that at least started pre-exposure prophylaxis, 16 of them had a positive result for syphilis. During the period when they had prophylaxis, we detected 5 more cases of 5 more positive cases, but it doesn't stop us because we don't understand that testing for infectious transmitted sexually make it possible to start early treatment, and all non-commercial organizations that provide such testing immediately transfer such patients to specialized designated clinics where they could get appropriate medical support. I have a question too. Svetlana, thank you very much for your great presentation. For Kazakhstan, it's a very relevant issue as we start to introduce pre-exposure prophylaxis. Are these services designed only for citizens of Moldova, or for migrants they're available too? Well, it's a very good question. Unfortunately, I cannot say for sure. Well, we don't have lots of immigrants. We have discussed this question, this issue, though. We were thinking of who can get access to such services. We actually provided to all those who need them, but we do not have so many immigrants as Russia or Kazakhstan, so it's not very relevant to us. Any other questions? Well, if we have no questions, okay, one more. A few short questions. Svetlana, one question to you. As it was said, we start to introduce pre-exposure prophylaxis. Can you say how many of your patients have short-term and long-term treatments? Out of 192 patients, 130 were men having sex with men, so they got short-term treatments that are recommended to this designated group. So 42% take long-term courses, undergo long-term courses. Sometimes we do a transition, we make a transition from one group to another group. Some of them start from a long-term course, then they switch to a short-term, and vice versa. It depends on the consultation. So it would be hard to plan procurement, right? I understand, very good. And I have a question to Alexey. So I have a question. We had a similar situation in Kazakhstan during the pandemic COVID-19 when specialists of non-governmental sectors deliver medications to the patients, but we don't have appropriate regulations. So how do you deliver these medications? Well, we do it with the support of foreign organizations. So you do it at the cost of your own organization. I was not talking about the costs. I was talking about the regulations. What laws do you use in order to make it 100% legally? Sorry, unfortunately, the answer is not heard by translators as the speaker is not using the mic. Okay, I see. I have a comment. We used a similar practice, but we have a decree by the Ministry of Health that regulates all the terms. So those are regulations that are working for the pandemic. Well, this is your strength. You do it in a very good way. Yes, we cooperate closely with our governmental bodies. Yes, and it's a very good example for us. And you showed the cost of the treatment costs. So mixed, yes. So you showed some mixed medications, some of foreign production and some of local production. It seems a bit expensive. So first question from you. I'm counting all your questions. So talking about essential drug use, what are criteria to include drugs into it? Well, this is a question that shall be addressed by the Ministry of Health. They have to answer that question. Again, the speaker is not using the mic. So there is a procedure that in detail describes the ways for a drug to be included in the essential drug list. Well, we have nothing to do with it. Representatives of the Ministry of Health are going to attend the conference tomorrow. They will be happy to address your questions. So if you are interested in continuing our discussion of prophylaxis, we welcome you to the next session. In the meantime, let's enjoy the coffee break.